Assalamualaikum warahmatullahi taala wabarakatuh. Alhamdulillahi rabbil alamin wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi wa ashabihi ajma'in. A very good morning to all. Yang berbahagia Professor Emeritus Datuk Dr. Syed Muhammad Al-Junid, President Malaysian Health Economic Association and the Program Advisor. Fantastic speech this morning. Yang bahagia Professor Dr. Muhammad Rizal Abdul Manaf, Chairman of the 18th Postgraduate Forum Committee, who is also my good friend. Yang berbahagia Professor Dr. Rosita Hod, Head of Public Health Medicine Department. Yang berbahagia Associate Professor Dr. Saharuddin Ahmad, Head of Family Medicine Department. Distinguished speakers, participants, ladies and gentlemen, a very good morning to all of you. Apabila laut dilanda ribut, ombak memecah angin gemuruh. Apabila mulut tersalah sebut, banyak fitnah membawa gaduh. Distinguished guests, ladies and gentlemen. Now you'll be surprised to hear that pantun. In the opening speech, I have recited to you a traditional Malay pantun quoted in a collection of Riau Malay pantun in 2016. Now a pantun, for those our guests from Thailand, Indonesia, I'm sure you're very familiar, is something which is very rhythmic verse that symbolize the subtle yet meaningful expression of ancient wisdom of the Malay culture. Now, this pantun visualize the importance of taking absolute care in things that we say or claim, and indirectly why evidence-based approach is probably the best during these trying times of misinformation and chaotic uncertainty. And undoubtedly, the last 2 years have been the most challenging for transnational institutional relationships as global networks shut down due to inevitable closing of international borders. Now, more than ever, we learn how precious meetings like this are and why they matter even more as we try to pick the pieces after the devastating global pandemic in modern human history that shattered the lives and the livelihoods combined. I've heard that you've said this is the 18th meeting. Congratulations. Many meetings have taken place in between, and I was told that you actually rotated between the ASEAN countries. It's fantastic as well, because we are having the World Congress of Surgery. For the very first time, Malaysia is hosting it at the end of this month as well. That's the 50th World Congress of Surgery. So we understand very much that how meetings like this actually mean so much to all of us. During the time that the COVID pandemic, I got a lot of neck pain and back pain. It's not good. Not good for your health as well. Because for 8 hours a day, we are having meetings online. First of all, let me extend the warmest welcome on behalf of the Vice-Chancellor, who's unable to be here today, to fellow ASEAN delegates from University Gajah Mada and Prince Songkla University. You're very welcome, and the durian season is on at the moment. We are gathered here today to celebrate this long-standing partnership between our universities, as well as to acknowledge the good relationship with our close neighbor, University Pertahanan Nasional Malaysia, who I gather are here today. I believe it has been nearly 2 decades ago since this forum started, as we mentioned, and we are indeed honored by your continued support thus far and pray that we only get stronger in the future, inshallah. It's always been our common intention to continuously improve the quality standards of research produced in the region for the benefit of all, as mentioned by Professor Emeritus Study. And I urge everyone to always self-reflect on what we put on paper and take pride in being patient, carefully and meticulously checking and rechecking our data for its precision and accuracy. Indeed, we have this large hospital here for our faculty and the hospital staff. Is a gold mine. If you look at the number of patients that come across this hospital, at least easily 500,000 a year, and over the last 26 years of the existence of the hospital, there are rich in data that we can actually learn from and perhaps use that for good effect to make a very informed policy for the use of the country. We are now at an inflection point where the world is changing rapidly in the post-pandemic era. Ladies and gentlemen, as we begin this forum, I would like to reflect on the importance of our collective efforts in the realm of health systems and policy. Health systems are the backbone of any society, determining how healthcare services are delivered, financed, and accessed by the population. Effective health policies are essential in ensuring that these systems are robust, equitable, and responsive to the needs of all individuals. You've heard it before. I'm a surgeon. When we operate on one patient, we save one life. But for all of you who made good policies, you can save many thousands of lives. But remember, you make wrong policy, you also kill thousands of lives. Yeah. So it is very important, like meeting like this, that you come up with a formulation to advise those policymakers what a path that we shall follow in the future. And the challenges we face in health systems and policy are complex and multifaceted. From addressing disparities in healthcare access and financing to navigating the impacts of global health crisis, our work is critical in shaping our healthier future. This forum provides us with a unique platform to discuss these challenges, exchange knowledge, and develop innovative solutions. Over these 2 days, we will hear from distinguished speakers who are experts in their fields. They share their valuable knowledge on a range of topics, which include health equity, health system and policy integration, health workforce and finance, universal health coverage, health in sustainable development goals, primary healthcare and preventive healthcare, big data usage in policy, technology-based policy, and so on and so forth. Recently, I met Tan Sri Bakar. He was asking, are you ready for the next move? I said, what next move? The 4 Ps. Your 4 Ps. So hopefully that you discuss the 4 Ps. Later we can sit down and say, what are the 4 Ps? Your population health, your preventive medicine, your precision medicine, and preventive medicine. Yeah. So let us take this opportunity to challenge conventional thinking, explore new ideas, and collaborate on solutions that can drive positive changes in our health systems. Our collective efforts have the potential to make a significant impact on health outcomes and contribute to the creation of more resilient and equitable health system worldwide. Not only equitable, I think resilient is very important. We've seen it during COVID. I think looking at sustainability is also important. We talk about high financing system. We find more and more difficult to finance the health provision that we are giving now without compromising the quality of care, without making sure that we are fair to the public. But as we discussed earlier, Datuk said, somebody got to pay for it. If it's not by tax, then it's going to be the user. If it's going to user, do you have the political stomach to actually do it? Yeah. So lastly, I would like to extend my heartfelt thanks to our speakers, panelists, organizers, and participants for their contributions to this forum. And your dedication and passion are truly inspiring. And I wish you all a productive and a very enlightening forum. With that, Bismillahirrahmanirrahim, in the name of Allah, I hereby officiate the 18th Postgraduate Forum on Health System and Policies. Thank you very much. Wabillahi taufiq wa hidayah. Wassalamualaikum warahmatullahi ta'ala wabarakatuh.